Welcome. Today we're diving deep into a complex group of disorders that can significantly impact the nervous system, autoimmune vasculitis. We'll explore what it is, how it affects the body, and what can be done to manage this challenging condition. The precise cause of autoimmune vasculitis remains largely unknown, but it's believed to be a complex interplay of genetic predisposition and environmental triggers. Certain infections, medications, and even underlying autoimmune diseases can sometimes kickstart the process. Essentially, the body's immune system, which is meant to protect us from harm, mistakenly attacks its own blood vessels. Autoimmune vasculitis is characterized by inflammation of the blood vessel walls. This inflammation can narrow or even completely block the blood vessels, restricting blood flow to vital organs and tissues, including the brain and peripheral nerves. This lack of blood supply leads to tissue damage and organ dysfunction. In the nervous system, this can manifest as a variety of neurological problems, depending on which blood vessels are affected. Autoimmune vasculitis is considered a rare disease. Because of the various forms of vasculitis and their varied clinical manifestations, the precise prevalence and incidence are difficult to ascertain. It can affect people of all ages, ethnicities, and genders, although some types of vasculitis are more common in specific populations. Accurate statistics are still being gathered to fully understand its impact on the global population. The symptoms of autoimmune vasculitis are incredibly diverse, reflecting the widespread nature of blood vessels throughout the body. Neurological symptoms can include headaches, seizures, stroke-like symptoms, numbness, tingling, weakness in the limbs, and vision changes. Other common symptoms include fatigue, fever, weight loss, skin rashes, joint pain, and abdominal pain. Because of the range of symptoms, diagnosis can often be delayed. Diagnosing autoimmune vasculitis is a complex process. It typically involves a combination of clinical evaluation, blood tests, imaging studies, and, in many cases, a biopsy of the affected blood vessel or tissue. Blood tests can help identify elevated inflammatory markers and specific antibodies associated with autoimmune conditions. Imaging techniques like MRI and angiography can visualize blood vessel inflammation and narrowing. A biopsy is often crucial to confirm the diagnosis by directly examining the blood vessel wall for signs of inflammation. Autoimmune vasculitis encompasses several different types, each affecting specific blood vessels and causing unique symptoms. Some well-known examples include giant cell arteritis, primarily affecting the arteries in the head and neck, arteritis, mainly impacting the aorta and its major branches, polyarteritis nodosa, which can affect medium-sized arteries throughout the body, and ANCA-associated vasculitides, such as granulomatosis with polyangiitis, GPA, and microscopic polyangiitis, MPA. The specific classification of vasculitis guides treatment strategies. The primary goal of treatment is to suppress the immune system and reduce inflammation. This typically involves the use of corticosteroids like prednisone and immunosuppressant medications such as cyclophosphamide, methotrexate, or azathioprine. In some cases, biological therapies like rituximab may also be used. Treatment plans are highly individualized, taking into account the type and severity of vasculitis, as well as the patient's overall health. Managing symptoms and preventing complications is also a vital component of care. Unfortunately, there are currently no proven methods to prevent autoimmune vasculitis. However, avoiding known triggers, such as certain medications or infections, may help reduce the risk in susceptible individuals. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, is always beneficial for overall health and immune system function. The prognosis for autoimmune vasculitis varies widely depending on the type of vasculitis, the severity of the disease, and the individual's response to treatment. With early diagnosis and appropriate treatment, many individuals can achieve remission and lead relatively normal lives. However, relapses can occur, and long-term management is often necessary. Ongoing research is focused on developing more targeted therapies and improving our understanding of the underlying mechanisms of the disease. Advances in biomarkers are also showing promise for earlier diagnosis and better monitoring of disease activity. Thank you for joining us today. Hopefully you learned something new.